Welcome students, welcome new students, and welcome back to the students who are returning. I'm Jacqueline Montrose, and I'm the Dean of the School of Social Welfare at Stony Brook. We are so very glad you chose us and you are here with us this year. We are excited that you're the next generation of social workers and you have very important roles to play in all the things that are happening right now, including the health crisis we're experiencing, the economic problems that we're experiencing, and of course, the anti-racism work that we are all doing. But what a moment to join the social work profession. We are, of course, very concerned that you're safe and secure as you're entering your field internships. Of course, we know most of you will be working remotely. We're sure you have questions about yourself, your organization, and will want to answer questions that your clients have. So I want to introduce you to a special video we have put together for you. We have two experts that are joining us who will sort of walk you through the safety things you need to be concerned about and the clinical issues and organizational issues that you need to know about to prepare to enter a field internship this year. The first is Dr. Farah Haq, who is the Director of Occupational and Environmental Medicine at the Department of Family, Population, and Preventive Medicine for Stony Brook Medicine. And the second is someone you probably already know, Warren Graham, our Director of Field Education, and someone who has done an amazing job to get ready for field this year. So everyone, enjoy this video, learn from it. We'll see you soon. Bye.
Thank you, Dean Montrose. So I will briefly discuss COVID-19 transmission and symptoms, and then review general protective measures, including masks, social distancing, and hand hygiene. Professor Warren Graham will then discuss specific guidance for social work internships. So COVID-19 illness is a viral illness caused by the SARS-CoV-2 virus. Currently, it's believed that transmission is primarily through respiratory droplets from actions such as talking, coughing, sneezing, and even breathing. There's a lot we are still learning about the virus, and at this point, we don't know whether and how much airborne transmission or transmission from contaminated surfaces may play a role. So COVID-19 symptoms, there are many possible symptoms. This list on the left is from the Centers for Disease Control and Prevention, or CDC. And as you can see, some symptoms, fever, cough, shortness of breath, you may have heard about in the news initially as being associated with the illness, but there are many new symptoms that have been added to the list. And many of these symptoms are very common and can be seen in many other conditions aside from COVID-19. Isolated symptoms such as a headache or a runny nose may not necessarily be a cause for concern if it's typical for you. For example, if you typically have some runny nose in the fall with seasonal allergies and your symptoms are consistent with your allergy symptoms, then that may not be a concern. Please keep in mind that COVID-19 can affect many different body systems, and this list of symptoms is not all-inclusive. Symptoms may appear anywhere from 2 to 14 days following exposure to the COVID-19 virus. And it's very important to keep in mind that individuals may be asymptomatic or pre-symptomatic. So some individuals won't show any symptoms at all, though they are infected, and some individuals may take a few days before they show symptoms. This really underscores the importance of practicing social distancing and wearing your mask whenever you interact with anyone outside your household, indoors or outdoors. So what if you do develop symptoms concerning for COVID-19? The main takeaway is to stay home. Do not physically report to your internship or classes, and do notify your supervisor. If you have any severe symptoms, you should seek emergency medical care. Otherwise, you can monitor your symptoms and consult your doctor or student health services regarding medical evaluation or testing. On the right of this slide, I've included a screenshot of a tool from the Centers for Disease Control and Prevention. It's called the Coronavirus Self-Checker tool, and it's an interactive tool in which you can enter information about your symptoms, your exposure history, where you live, and the system will provide you some guidance in terms of testing. The New York State Department of Health also has a testing hotline and an online screening tool, and the links and information are included here. So what if you've had close contact with a person diagnosed with COVID-19? Currently, the CDC defines close contact as being within 6 feet of a COVID-positive individual for greater than 15 minutes, regardless of whether either of you are wearing masks. If you have had close contact with someone who you recently learned was diagnosed with COVID-19, you should remain at home and self-quarantine for 14 days from your last exposure to that individual. You should monitor your temperature twice a day and monitor for symptoms of COVID-19. Now, the local health department will be providing quarantine instructions for close contacts. What if you recently returned from travel? New York State currently has a self-quarantine requirements for individuals returning from travel from states with high COVID positivity testing rates. This list is continually changing, and the link over here will show you the most updated states. But if you do travel to those states, you are supposed to self-quarantine. What if you need COVID-19 testing information? You may consult your doctors, student health services, or contact the New York State Department of Health testing hotline at 888-364-3065. Okay, now we'll focus on protective measures. Masks or face coverings are one of the tools we have at our disposal to prevent COVID-19 transmission. But for masks to be effective, they have to be worn properly. So how do we wear a mask safely? First thing is to wash your hands with soap and water or use hand sanitizer before putting on the mask. You should place the mask over your nose and mouth. It should cover both the nose and mouth, and secure the mask under your chin. If you press around the bridge of your nose to achieve a better fit, that will be most effective. You want the mask to also fit as snugly as possible against the sides of your face. So you want to minimize any gaps on the sides of your face. And once you have the mask on, just make sure that you can breathe and talk easily, because once you have it on, you really don't want to touch and readjust it. As I said earlier, you want to avoid touching the mask frequently, especially the front of the mask, which can become contaminated. And if you do need to readjust it, wash your hands both before and after. When removing the mask, you should try to only handle the straps or the ear loops, and then wash your hands after removing. This infographic from the World Health Organization illustrates these tips that I just went over. So you may have heard about or seen several different types of masks, and I wanted to briefly compare the different categories of masks. So an N95 is actually a respirator. It provides respiratory protection from airborne particles to the wearer. It's intended to be used by healthcare providers, and because there is currently a worldwide shortage of N95 respirators, it really should be reserved for healthcare providers. An N95 respirator is considered a tight-fitting mask, and it actually has to be fit tested. That's a special process where they ensure that the mask achieves a close seal and is able to protect the wearer. Now, N95 respirators cannot be washed. They have to be disposed of if visibly soiled or damaged. And the National Institute for Occupational Safety and Health is the organization that tests and certifies the N95 respirator. You may have heard of KN95 masks. Those are regulated by the Chinese government. They offer a similar level of protection as an N95 respirator. However, only a few manufacturer models have been approved by the U.S. Food and Drug Administration for emergency use in the United States. And there have been some concerns earlier this year that some counterfeit models were being sold to consumers. So that's important to keep in mind. Surgical masks are another common category. The purpose of a surgical mask is actually to reduce the exposure of others to your own respiratory droplets. A surgical mask may protect the wearer, from splashes and large droplets, but it's not considered respiratory protection the way an N95 respirator is. Again, it's intended for use by healthcare providers. It's a medical grade mask, and it's usually reserved for healthcare providers. There's no fit testing required for a surgical mask. It's considered loose fitting, although as I mentioned earlier, you do want it to be as snug as possible and try to fit it as closely as possible to your face. Surgical masks are disposable. They cannot be washed. And if they become wet, soiled, or damaged, you should replace them with a new mask. These are regulated by the Food and Drug Administration. And the proper way to wear these masks is to have the folds facing downwards. And there usually is a little wire that can be molded to your nose to help it fit better. And finally, cloth masks or cloth face coverings. Again, the purpose of these face coverings are to reduce the exposure of others to your respiratory droplets. They're not proven to protect the wearer. However, they probably do offer some protection from large droplets or sprays. Their use is intended for the general public. These are considered loose-fitting masks. There's no fit testing, and they're not regulated by the Food and Drug Administration. These can be reused, and if you reuse them, they should be washed daily after each use. You can toss it in your regular laundry with your laundry detergent and wash it on the hottest water setting that the fabric will allow. Or you can hand wash it with soap or with a bleach solution. It's important to let it completely dry before wearing it again, whether in the dryer or air dry. And if it does become wet or soiled at work, you should change it out and replace it with a fresh cloth mask. For it to be most effective, the mask should have multiple layers, at least 2 layers, preferably 3. There was a recent study that said that gaiters, some of the types of face masks like gaiters and bandanas were not really very helpful. So you should look for a mask with multiple layers. So another important tool we have at our disposal is hand hygiene. Hand hygiene can protect us not only from the virus that causes COVID-19, but multiple other pathogens. Now, the preferred method for hand hygiene is soap and water. You want to scrub your hands with soap and water for at least 20 seconds. And you really want to use soap and water if your hands are visibly soiled. In the absence of soap and water, hand sanitizer is a good alternative. The hand sanitizer should contain at least 60% alcohol. And you want to apply enough such that you can cover the surfaces of both your hands and fingers, and enough such that it takes about 20 seconds to dry after you apply. We recommend performing hand hygiene frequently, but always before putting on a mask and after removing or handling your mask. Should also be performing hand hygiene before and after eating and after using the restroom, and whenever hands are visibly soiled. If you're working in a healthcare setting, you should follow the hand hygiene criteria for healthcare settings because it will be more frequent and there will be requirements to use hand hygiene before and after seeing patients. So social distancing, that's the other cornerstone in preventing COVID-19 transmission. Social distancing means maintaining a 6-foot distance from others, indoors and outdoors, regardless of whether people are wearing masks. It's very important when you do not have 6 feet of distance between you that you wear the masks. And also indoors in general, you should be wearing masks regardless of whether people are maintaining social distance. To facilitate social distancing, we recommend that you meet others in large, well-ventilated spaces, or ideally outdoors if it's feasible. We tend to be good about remembering social distancing when we're out in public or perhaps when we're meeting with clients or patients, but it's important to maintain the precautions around our coworkers and classmates as well. So do keep this in mind when you're eating lunch or when you're in the break room. You do want to maintain that 6 feet distance. That can be challenging when you are taking the elevator. So it may be a good idea to just make a habit of taking the stairs or wait for the next elevator to avoid overcrowding. So I'm now going to turn this over to you, Warren, so you can talk about more specific measures for the student internships.
Thank you, Dr. Hawk. So what I'm going to first talk about is internship site precautions. These are some of the things that you should be thinking about as you begin your internship, or you're starting to conceptualize exactly what your assignment is going to be and how you're going to move throughout your workday. Before your internship, we would say definitely obtain and review COVID-19 precaution material from the CDC, Department of Health, because that's going to actually lay out some of the things that Dr. Hawk referenced that are going to be important to you to remember as it relates to safety. So we have, in the Office of Field Education, we have discussed safety precautions with all your community-based agencies, and this has been referenced in Ready, Set, Go. So this is a great opportunity to really preface the conversation by speaking to your field instructor to see exactly what the agency's safety protocols are as it relates to COVID-19. And these are some very specific questions you may want to ask. Is there a process for screening employees and interns for COVID-19 symptoms? What is the follow-up process if there's a positive screening? What is the screening process for clients with whom you may have had physical contact? The same questions regarding symptoms, close contact with positive cases, travel, etc., should be asked of clients each and every time you actually meet with them. Social distancing precautions at the workplace should be in the forefront of your minds as you're not only keeping yourself safe, but you're also concerned with keeping your clients safe. Masks, will they be provided to interns? How many masks? What type of masks? Or will they be provided by the school? These are things that you should be thinking as it relates to safety precautions. And finally, who do you contact if you have any questions regarding the process? So considering this pandemic, what we're really talking about is emergency management and supervision. So it's very important for students to be aware of the agency's protocols of managing any type of emergency, which include, and I'm going to continue to reinforce some of these questions, what do you do if you're symptomatic? You do not report to the internship. Who do you notify? You notify your field instructor. If you can't reach your field instructor, you notify a task supervisor if one is provided to you. You notify your field liaison. You notify someone in the Office of Field Education if you actually have to. Who do you contact if you're concerned about your health? Is it the student health center? Is it your primary care physician? These are very important questions, as well as the communication with your actual internship site. Remember, it is about your safety, but it's also about the safety of the clients seen at the agency. So if you're feeling unwell, you definitely need to take care of yourself. And by not showing up, you're also taking care of your clients. But you have to be in contact with your field instructor to let them know exactly what's going on in the moment. Who do you contact if someone violates agency policy around COVID-19 safety protocols? What about fellow interns? What about employees that you may be working with of the agency? It's important to really have this conversation so that you know exactly what steps need to be taken if you find that someone is violating, let's say, social distancing or not wearing a mask. And finally, how are agencies informing you, the student, of their safety measures? These conversations have been had with agencies, and we've asked them to articulate an actual response so they are aware that you are going to be asking these questions and they should be prepared. And as always, start from the assumption that everyone is at risk so you can be better prepared to be safe. Now, what I have here is basically an example of a suggested safety plan as submitted by one of our community-based organizations and partners. And this is how it reads. The interns will complete formal training regarding COVID prevention, precautions, and symptom identification and reporting procedures. All staff and students will have temperatures taken and complete a screening upon entering the building each day. Masks are distributed and hand sanitizer is provided. Office space is allocated and shields are being put into place as protective barriers where needed. WebEx meetings are being utilized to reduce congregation of staff. While most assignments are remote, for the ones that are physical and in person, it is also important to notice that, or note that that doesn't preclude you from still having the conversation with your field instructor to minimize contact with clients to do as much remote work as possible. So in your preparation for risk, one of the things that you can do prior to starting your internship is really doing some homework on your prospective agency. What is the agency life and culture in that site of facility? What is its mission? Who are the clients? How might the clients and what their population is be important for your safety? What are the services offered and how are they actually delivered? Are they in person? Are they on site? What organizations does the agency interface with and what are their goals? We work in a very collaborative way. So you need to be mindful not just of the clients that you're working with in your respective agency in the internship, but are these clients actually connected to other service providers? And if so, what are their safety precautions? This may be something that you may want to pay special attention to. What is the formal hierarchy of communication? What is the informal hierarchy? How do you know? As a point of rule, we say always start with your field instructor. Field instructor is going to be a point of contact. That's going to be the person who's going to really mold and shape and really make sure that the way you're practicing is consistent with the core competencies. And finally, what are the agency's expectations and what are your expectations around safety? There's no question that you can't ask regarding precautions and protocols that the agency should not be prepared to respond to and answer. As you're preparing to embark on your internship, it is important to note that there are some settings that may be considered higher risk than others, like crowded facilities, like homeless shelters, facilities where physical interaction with children or those with developmental disabilities may be possible who may not be wearing masks or maintain 6 feet of social distancing. And if you're doing home visits, make sure you discuss with your field instructor the very specific safety precautions for the higher risk setting so that you can be protected at all times. And these are some strategies that you may want to introduce into the conversation. Request a remote visit option. Confirm clients have been screened for COVID-19 symptoms. Safety, travel. These are things that you want to incorporate into your higher risk setting kind of protocol. Move client interaction outside if feasible, into a well-ventilated area that may help reduce your risk as well. Utilize plastic barriers if available to you. Consider using eye protection, face shields, goggles, eye shields. Avoid touching objects or exchanging objects with clients. This is very important. Wash or sanitize hands before and after meetings. Keep hand sanitizer with you, especially if you can avoid exchanging objects with clients. You definitely want to make sure that you sanitize if you're not in a position to wash your hands afterwards. So in summary, your health and safety is of utmost importance and paramount to us. So we hope that you found this presentation helpful. Please wear a face mask that covers your nose and mouth. And Dr. Hawk did an excellent job going over exactly how that should be done. Maintain at least 6 foot of social distance, both indoors and outdoors. Practice frequent hand hygiene. Stay home if any symptoms of COVID-19 present themselves and seek medical consultation or testing as needed. Familiarize yourself with the agency's safety precautions and screening processes. And finally, get your flu shot this fall. The medical professionals are unsure exactly what the season is going to look like, considering we are still in this pandemic and the flu season is going to be upon us shortly. Finally, we hope this has been helpful. If you have any questions, please contact the Office of Field Education. Please contact the Student Health Center, your primary care physician. And as always, we look forward to working with you. Thank you.